Well, welcome everybody. My name is Bea Moorhead. I'm the director of Texas Impact, and you also didn't come to hear me talk. I am happy to introduce, come on up, Congressman. I'm happy to introduce our special surprise guest speaker today. Congressman Lloyd Doggett is in town. He has just been over at the Capitol for a rally, Cover Texas Now, the health coalition that Texas Impact is part of. And he just has a few minutes to talk with you. He's going to talk to you about the urgency of healthcare at the national level and answer any questions you have.
Thank you, Bea. Thank you so much. It's good to join friends here and those who are watching us on Facebook Live. How wonderful that Texas Impact and all of you who are associated with it across Texas continue to make an impact by putting your faith to work, by living your faith. This is a perilous, it is a dangerous time in the history of our country. And it's a time not to give up or give in, but to participate a little more, and for us to bring our neighbors, whatever their political perspective, to make them understand the dangers that we face and how working together we can overcome them and turn this country around. I just want to give you a quick update on what's happening on the Affordable Care Act. A few years back, in 2009 to be precise, I was serving on the health subcommittee that was involved in the initial work in writing the Affordable Care Act. I went out, as I so often do, to a grocery store in Southwest Austin to have what I call neighborhood office hours. Usually it's to hear from someone who didn't get their Social Security check or someone who knows how to solve the federal deficit. You get a lot of good ideas and good contact. This particular Saturday morning, I had the surprise of about 150 or 200 people yelling, "Just say no to health care," and holding up banners, and they had a coffin for my early demise as a supporter of healthcare and the like. And I engaged with them for an hour and a half or so, and finally decided that we couldn't conduct any more business and departed. It was the very first across the country of the protest against Obamacare by the Tea Party. The most frequent cry of folks that morning, and for weeks after with colleagues across the country, was, "Read the bill." I saw on the internet that page 962, line 14, provides for death panels, or whatever was the myth of the day. Well, the problem that we have this week is that on the replacement for Obamacare, which has been discussed by my Republican colleagues for the last 6 years, we have no bill to read. On Wednesday morning, that's the day after tomorrow, our colleague from Houston and North, Kevin Brady, will gavel into order the House Ways and Means Committee on which I serve. And Fred Upton on the House Energy and Commerce Committee will do the same. And we will begin the consideration of the bill that they have come up with, the plan that they have come up with to replace the Affordable Care Act. We will not have seen that bill until sometime tomorrow, which presents some real problems in trying to develop amendments to offer to that bill. All we have really now are rumors, gossip, and a leaked draft that may or may not be what they are focused on that came out in late February. I led an effort on the Ways and Means Committee that all Democratic members joined that said, let's have a public hearing on this bill, because we've never had someone come forward and tell us what's good and not so good about this plan. We've not had a single public hearing on it. So let's have an expert come that we can question about it. Second, in my history on the committee, I don't believe we've had a major piece of legislation where we could say, we don't know what this bill cost, because they are jamming this bill through without having what's called a score from the Nonpartisan Congressional Budget Committee or an estimate of the tax impact from the Joint Committee on Taxation. You'd think that Republican colleagues who usually talk about fiscal responsibility would want to know what this bill costs, but when they vote for it on Wednesday or Thursday morning early in the late at night, we will not know the precise cost that it has. And finally, to be a bit bipartisan, when I heard President Trump say he wanted insurance for everybody, that he had a plan that would give us insurance for everybody and it would cost less and it would provide better care than Obamacare, I said, I want to be the first Democrat to endorse that. And I asked the Republicans, please bring us someone from the Trump administration to explain how this particular piece of legislation comports with what President Trump said he wanted. They have declined to do that, of course. I say that their approach is based on fear, on fantasy, and on fanaticism. So fearful not only that Democrats would see the bill, but they even blocked Senator Rand Paul from seeing the bill. It is under lock and key, or it was when I left Washington on Friday, in the Capitol, actually with a police guard to keep people from seeing the bill. Fantasy, because I think President Trump's description of his plan is fantasy. If there were a better approach that could be approved in this Congress as a substitute for the Affordable Care Act, we would already have seen it, and people would proudly be displaying it for you and people across Texas and America to be able to see it. And fanaticism, because unfortunately, there has been this fanatic passion to undo the Affordable Care Act no matter what. And that's what we face this Wednesday. Your participation, your contacting your members of the House is more important than ever. A big part of this bill will be block granting Medicaid funds. We know what block grants on Medicaid, even with some minimal federal standards that exist today, have meant here in Texas for children with disabilities and getting access to therapy, for seniors, many of whom have nothing else to turn to for long-term care other than Medicaid. Block granting Medicaid will mean less and less real federal spending power coming to Texas, and we'll see much of the benefits diverted by a Texas legislature that has not been too caring about these matters. So I would say on our committee, Kenny Marchant is a member, Sam Johnson is a member, I am a member on the Ways and Means Committee. I don't have all of the House Commerce Committee people, but Mike Burgess heads the Health Subcommittee. Gene Green from Houston is obviously a strong advocate for health care. But whether you're on the committee or not, the House as a whole is expected to have this bill jammed through by the end of March. And they're planning to try to take it up in the Senate in April. So they need to keep hearing from you and your fellow church family members about the impact of this. And then in addition to those of us in Congress, it's really important, as is happening here in Austin today, that people at the state legislature hear. And I just, as I walked out of the Capitol grounds just now, a woman from Cedar Park, just north of Austin, stopped me and was asking what she can do. And I could say, well, I've never represented that area, but I understand there are some city elections coming up in May in Cedar Park. Having people that will speak up, even if they don't have the discretion to allocate the dollars on behalf of humanity, whether it is defending our immigrant community, recognizing the value of having people of all faiths respected, whether they go to a mosque or a temple or a church. Those are important values, and these local elections and involvement are really important. That's my overview. If you've got any advice about this, I'd welcome hearing it, and I'd be pleased to respond to any questions as your program permits. B, thank you for your leadership, for being there for years, for doing such a great job. Yes, sir.
Many times, I've gotten through to the Austin office at times,
Yes.
so I can't leave a comment. That's pretty frustrating, and I know many of my friends have the same with everything. I hope that's not true with your office.
Well, it's not true with our office because everyone on my staff in San Antonio, Austin, and Washington at one time or another is on the phone taking input. And of course, we get a tremendous amount of social media. I invite you, if you can't get your representative to answer, to at least sign up to get updates on the Affordable Care Act or other issues of concern to you like immigration or clean air and clean water by going to our website. You don't have to be in my district to get those updates. But I don't have a solution for people who will not be responsive to their constituents other than to say, get another representative. And, you know, Roger's office is about 3 blocks from where we're standing here in Austin. And if you can't get through to Washington, I hope you contact him there. He has made himself very clear that as passionate as I am about the Affordable Care Act, he's passionate about returning to the system that we had before the Affordable Care Act, though most of us don't think that was a system. It was neglect. And I think he's going to stick by that position. And so it's a matter of being involved to voice your views, but being involved next year as well. Yes, ma'am.
I just want to tell people don't give up. Even though I know Senator Cornyn is probably on the other side of the Affordable Care Act, I took my grandson, this has been a couple of months ago, but the Legal Law Organization organized a rally at his office. And so I took my grandson with me. We went up and met with the aide, sat around the table. My first grandson was born deaf, and he has cochlear implant. Well, he is no longer even in special ed. He's in gifted and talented, but this operation gave him his mind, you know, his ability to hear and play music and all that. But if the pre-existing condition thing goes out, it could hurt him. He could have to have a revision. But anyway, the aide was very responsive, assured the group that Senator Cornyn was more interested in governing than politics. Now, Lloyd Doggett is the only person I know that's more interested in governing than politics. But anyway, it was a positive meeting. Don't give up. And what makes me curious about these reps that won't meet with their people, we're paying their office rent, we're paying their staff, we're paying their health care, we're paying their salaries, and but you know what I feel like is if we were Exxon or something, you'd get a front row seat to but don't give up, because we had a good experience. My grandsons, you know, I said, don't y'all want to run for Senate? It's up there in the same building with the headline coming. You're up here, and New Year's Day, my grandson told my daughter-in-law that he wanted to be the first deaf president.
Well, that's great. You know, I don't know if your Facebook Live viewers can hear any of these comments with the, can they? With, I'm going to summarize what were beautiful and extended comments to say that she was, had the experience of going to Senator Cornyn's office here in Austin with her grandson who is hearing impaired, and is telling us to not give up, to make your voice heard. And that's a very important message to convey. Senator Cornyn and Senator Cruz is up for election next year. They cover the entire state of Texas. There is no place you can be listening to us that you don't have the right to ask them to represent you. Many people have experienced difficulty reaching their DC offices. I urge you to contact their district offices if you have not been able to get through to Washington, and to send some communication that cannot be answered with a form letter, even though it probably will be if you get any answer at all. So very important to be involved next year in the political process, but to make your voice heard now. I will also relate to you a hopeful story, since you mentioned your grandson. Yesterday, I met a friend of my granddaughter who's a 4th grader. Her name is Amari. And Amari had organized at her school a political action committee. And their committee has already written about the wall to Senator Cornyn, Senator Cruz, and to one of our state representatives. Those are the kind of family values we need to encourage, that we do care about our neighbors, that we are, in fact, our brother and our sister's keeper, and that we care about it enough that we're going to express our concern. And just because we're told no the first dozen times doesn't mean that we will give up, that we will be sustained in our participation. Yes, ma'am. How generous of you.
I do have one quick question, and it's going to be an answer that you've already given us. But there was no people on the Senate committee that are going to be hearing this long.
This will be heard. Yeah, this will be heard in the House Ways and Means Committee and the House Commerce Committee. And the people that come to mind on Ways and Means, the chair is Kevin Brady. You've got it on the sheet, great. But though the committee action is this week, the committee action will probably be concluded by sometime in the middle of the night on Thursday morning. And then it eventually will go to the House Budget Committee, on which there are probably some other Texans. And then it will go to the House floor. And that's expected to happen this month. So your participation now is extremely timely. And then to the Senate probably in April for a vote. So let's continue to pull together. Thank you very much for your leadership. B, thank you, and for this surprise opportunity to participate.